level?
Yeah, my name is Dr. Michael Johnson. I am a board-certified general surgeon. I'm presently putting together a medical service in the city of Philadelphia for helping those who are underserved. For the past 20 years, I've worked overseas in Africa and in Kenya in particular as a surgeon, and I've just recently come back to the United States and kind of retooling, as it were, to work with the poor in Philadelphia.
We're glad you're back.
Yeah, it's good to be back.
So I have some questions for you regarding what's going on in New York State. 2016 presidential hopeful Andrew Cuomo is hoping to create make New York State kind of a bellwether state for women's rights and other things.
Yes.
And he's proposing a piece of legislation called the Reproductive Health Act.
Yes.
And the Reproductive Health Act essentially makes abortion and contraception fundamental rights. As a physician, what does this mean for you?
Well, as a physician, first of all, as a citizen, I think we sometimes get so far ahead of ourselves with regards to rights that we forget responsibilities. I think if we were to talk about our responsibilities more than our rights, we'd have a better hand on what we are as individuals and as a nation. So when we talk about fundamental rights, those are often overweighing our fundamental responsibilities. A fundamental right to me with regard to abortion means that a woman has the right to decide whether not only does she have a baby, but whether that baby has blue eyes or green eyes, or whether it's a boy or a girl, or whether it chooses to exist or not. And when you start reducing this to a fundamental right, then you start to further degrade the humanity of the individual. Does a person have the right to live if they are deformed? Does someone with a malformation, a fetal malformation, someone with Down syndrome, someone with a with one leg shorter than the other, then you get into fundamental rights of those who are the elderly. Do they have a fundamental right to live, or a fundamental right to shuffle off the planet so that we can make space for somebody else? So I think fundamental rights is a very dangerous thing when you talk about reproductive health rights. I think we have the fundamental right to say no before we engage in any activity that will result in pregnancy, and after that we have the fundamental right to bear that child, and then to offer for adoption or whatever other choices are. But that fundamental right, when it overweighs, when it overreaches and infringes on the rights of the unborn, it's fundamentally wrong.
In your estimation, does making a medical procedure a fundamental right shift the perspective on the doctor-patient relationship?
Oh, absolutely. I mean, there is no fundamental right to health care, in my estimation. I mean, people do things to themselves, and do they have an absolute fundamental right to have that thing undone? If you push the envelope far enough, I have a fundamental right for a mammoplasty. I want a breast augmentation. I have a fundamental right for that. I have a fundamental right to have my nose fixed because I don't like the way it looks. I mean, you cannot impose on the medical community the rights of a procedure, because there are no rights. We as physicians have the responsibility to provide the best care that we're capable of. But we cannot be forced to do a procedure because it is your right to have it. That goes beyond reason.
So would making abortion or contraception a fundamental right hinder the right of conscience for the physician?
Oh, absolutely. Because, I mean, if I believe that, whatever procedure you want to say, whether, if I believe that you don't need a gastric bypass or you don't need a tummy tuck, I mean, if you start introducing fundamental rights as part of my interaction with my patient, I mean, you can push this all the way down. And yeah, so yes, it interferes with my relationship with my patients. It interferes with my professional ethics, my personal choices as a physician, and I think basically you're gonna, if you start down that slope, you'll push a lot of people out of medicine.
Does it degrade the quality of medical care that a patient would receive?
Yes. Medicine to me is a calling. I mean, if I'm forced to do things, I'm not going to do it the way I would do it if I felt in my own heart that I need to do it. So yes, it will degrade the care, because then I'm just really pushing buttons, as it were. It interferes with the fact that this is a person in front of me, as opposed to this is just another widget I've got to get out of the way.
So making a medical procedure a fundamental right serves to dehumanize?
Absolutely. Oh yeah, dehumanize, because this is not a person. This is a client. This is a thing that I have to do because someone's told me I have to do it. Otherwise, I'll suffer the consequences, whatever those consequences may be.
Amazing. Hey, Frida. Another thing this bill does is it totally dehumanizes the life of the child in the womb. Mm-hmm. How does that impact the ability of a physician to engage a woman facing an unplanned pregnancy, in your estimation?
Yeah, well, whether you're pro-life or pro-choice or don't know what you are, if I can only speak of the entity, or I feel the person, if I can only speak of that person as a thing, if I'm not allowed to look at the woman and say, I believe this is life inside of you, if I can't do that, then it totally restricts my language. And so I have to come out of my own personal beliefs, whether they're religious or not, and I have to restrict to I'm restricted to the political language, or the politically correct thing to say. So it totally interferes with my relationship with my patient, because I believe that my patients want me to be myself with them. They don't want me to be a government agent, as it were. They want me to be who I am.
Oh man, that's great. There's a couple other things in the bill that are particularly interesting when it comes to medical care. But generally speaking, what are your thoughts about government legislation in the medical profession?
Well, I think government legislation is necessary in the medical profession. Because, you do need licensing, you do need regulations, you do need, qualifications, you do need people to come back and look that you do what you say you do, and are not overreaching and not abusing patients.
A lot of the things in this particular piece of legislation serve to deregulate the abortion industry.
Well, I think the problem is we're defining abortion as health care. Abortion is not health care. That's the difference. So if we take it out of the health care mode, it has nothing to do with health care. It's not making anybody better. It's just providing a service, but it's not health care. No more than a facelift is health care. It's an elective procedure, rarely, extremely rarely done for the saving of a mother's life. So it is not health care. So we should call it something else, but it's not health care.
What do you think of the idea of non-physicians performing surgery as a surgeon?
Non-physicians performing surgery as a surgeon. That's an amazing concept. Well, in that sense, you could really open it up for anybody. You could have non-dentists doing dentists and non-architects designing buildings. the study of medicine is well beyond just the mechanics of knowing how to do something. It's knowing when and why to do something, and that is what makes a physician a physician. That's what makes a dentist a dentist. I mean, so for a non-physician to be doing it, it just reduces it to a mechanism. And if that's what you want to do, that's why, again, abortion is not really health care. It is providing a service, but it has nothing to do with health care. If you want to have people that's all they do, and then that's what they do, then that's what they do, but it has nothing to do with health care.